Okay. So thank you for coming. We've got a really great turnout, and welcome to the second COVID-19 champion meeting. It's a bit last minute because of the changes in restrictions from the government this week, but Justin's here to talk us through those new restrictions and what we need to know, and answer any questions that you might have. If I could ask you to mute if you haven't muted already. And if I can also ask you to turn your cameras off, that would be really helpful. It helps your bandwidth and keeping everything running smoothly. If you've got any questions along the way, that's absolutely fine. If you can use the chat box, what we will do is towards the end of the meeting, when Justin's explained everything, we've got some time to go through some of those questions. So we will go through that way using the chat box. Okay. So I guess there's nothing more to do really. So Justin, over to you.
Great, thanks Mel, and hi everyone I haven't met before. Welcome to the Champions webinar. It's great that we're on 3 pages now, and ever increasing numbers. Do put your questions in the chat box and I'll try and cover them off as we go. So I'll just start by talking a little bit about where we are on the numbers at the moment, and then I'll talk a bit about what it means to be in tier 2 where we are now. Some of the common questions I get asked already about what does this mean, and then I'm happy to pick up any questions from you as well as we go along. So the first thing is to say that in terms of the pattern in Birmingham at the moment, we are seeing that the number of cases continues to rise. We've seen overall what that's showing us is the percentage of tests that are positive is staying about 9%. Testing is increasing, which is why we're seeing case numbers rise. So we're kind of stuck again. And throughout the outbreak, since we've come out of lockdown, Birmingham, unlike areas like Manchester and Liverpool, which have had a very kind of vertical rise, Birmingham keeps going up a bit, down a bit, gets stuck, up a bit, down a bit, get stuck, up a bit, down a bit, get stuck. So we kind of go as a stepwise progression, which is much, much slower than many of the other areas. And they think, we've been talking with the Department of Health and the Chief Medical Officer's team about this, that this probably reflects the restrictions we've had on social mixing in households, and actually showing the impact that they are having. Now, if you do want to look at the numbers every day, I put the link in the chat to the NHS progression dashboard, which is the national public facing data and looks at what the case rates are over the last 7 days. What I would say is if you do look at it every day, you'll see that the rate goes up and down depending on the day of the week. And this is a reflection that people test on different days of the week. And we do see that there's a bit of a spike in testing. So more people do tests on a Wednesday and Thursday than on a Saturday and a Sunday. And that kind of changes the way results come through. So what I would suggest is pick the day you want to look at it and just look at it the same day every week, and that will give you a better sense of the direction of travel. But you're able to see that. The latest rate on that website, which is for the 7 days leading up to the 13th of October, is 166 cases per 100,000 for Birmingham. Running behind us is Solihull at 159 and Coventry at about 153. And Birmingham, as I said, has done this kind of stepwise. We go up a bit, go down a bit, and it's a much slower rate of ascent than we're seeing in some of the areas. As I said on last week's call, we have seen a shift in the profile of people who are catching COVID. So that we've seen significantly an increase in our white communities and in our elderly population, but we've also seen a big increase in the 18 to 22 population, which is predominantly first-year students. That has calmed down actually in the last week, so we're interested to see how that develops over the coming weeks and days. We are also seeing an increase in hospitalizations, and it's important just to explain again that the cases happen in the community. And then about 4 to 6 weeks later, you start to see those people who've caught COVID start to appear in hospital. And that's because the people who tend to get sick with COVID either get sick very, very quickly, or it takes quite a long time and they gradually get worse and worse and worse and then end up in hospital. So the majority of that pattern is you get case rise first in the community, and then about 4 to 6 weeks later, it starts to rise in hospitals. And another 2 to 3 weeks after that, deaths rise. So that's the pattern we're seeing at the moment, that the increase in people going to hospitals is really reflecting what happened about 4 to 5 weeks ago in the community. And sadly, that means I expect that hospitalizations will continue to rise. We are seeing the same kind of pattern of inequalities, that hospitalizations are more common in the older population and more common in our ethnic community populations again. So it's important to highlight that. So we were a couple of weeks ago already in as an area of national intervention with a restriction on household visiting. And as you'll be aware, the government decided to rationalise this and bring it into a structure where everyone had the same scale of interventions across the country. And there's a 3-tier model. And what I'm going to focus on is where we are, which is tier 2. So I'm just going to try and share from my screen a slide which I've stolen from the NHS, actually from the government, who put this up on Twitter. But I think it's quite a good way of summarising what you can and can't do. So at the moment, you cannot go into an indoor space with anyone that you don't live with. So that means you can't have anyone visit you at home. You can't go and meet them in a restaurant or in a pub. If you go to the cinema, you need to be sitting separately, socially distanced. So you can't book your tickets together. Outside of your home, so outside of indoor spaces, so whether that's in a garden, a park, or walking down the street, you can meet up to 5 other people, sorry, under the rule of 6. Now, what I would say is in Birmingham, we're advising people not to invite people over to the garden, particularly because it's quite cold and not very nice at the moment. And the temptation is if someone's in your garden, then they need to use the loo, or you offer them a cup of tea. And a bit like being inside, it's those common touch points where the virus spreads. So the general advice is avoid having people over into your garden, go for a walk down the street or in a park, enjoy some of the green space in Birmingham, the canals, etc. You can still go shopping, you can still use gyms, schools, universities remain open. The health service, the NHS, is definitely open, and it's really important to remind people that it's perfectly safe to go and see your doctor if you need to. Now, most of our GP services have moved to a triage system where they're asking people to phone first. And then they're only brought in if they're actually needed to have a doctor physically examine them or a nurse physically examine them. And what we're finding and what we're being fed back is actually that many of the GPs are finding, first of all, people turn up for their appointments, which is good, but also a lot of this can be done over the phone safely and appropriately. There are restrictions on indoor sport. So, and that includes indoor physical activity classes like yoga, for example, or Tai Chi. They are allowed, provided they have a risk assessment and people can socially distance appropriately. And that, again, is very similar to what we were before. But what you can't do is kind of have social sport where nobody's organising it. So rule of thumb, if there's a risk assessment and it's a physical activity class, it's probably okay. But you can't just go into a gym and kick around the football with 5 of your mates. Weddings and funerals have restrictions on numbers. So for weddings, and that's all types of wedding receptions, not just the legal reception, it's also the religious ceremony. There's a maximum of 15 guests. And for funerals, that's up to 30 guests. The 15 applies to receptions and also to the wakes. And wakes after a funeral and after wedding receptions have to be sit-down meals or sit-down in a venue, in a venue that is not a private home, and they have to have a risk assessment around them. Faith settings can continue to stay open and operate. They all have risk assessments as well in place. The bit where I have edited this slide is on overnight stays. So when the government talks about overnight stays, it basically means you can still go on holiday. But when you do go on holiday, it's important that you can't go and stay with friends or family. You can only go and stay in a hotel. And when you're on holiday, when you leave Birmingham, the rules still apply. So you can't go down to London or out to over to Wales and meet friends for dinner in a pub. That rule of not being able to meet another household indoors applies wherever you go now. But you can at least go and stay with the people you live with if you want to somewhere else in the country. There are restrictions on hospitality around closing time and table service only. Residential care is closed to external visitors, except in exceptional circumstances. And in general, that means the exemption is for end of life, compassionate visits. We are looking at this continually. There is a national task force looking at whether there can be flexibility to allow, for example, window visits in areas in Tier 2 restrictions. And I had a conversation explicitly about that earlier today with the Deputy Chief Medical Officer for England. So I do expect we'll get some more guidance on that in the next couple of days, probably next week, I would expect though. There are exemptions for childcare, and that allows family childcare to come into a private home, and the full details of that are on the government website. We encourage everyone to work from home where you can. There are some entertainment attractions that cannot open. So, for example, nightclubs and adult entertainment venues are not able to open. The advice on travel is you can travel wherever you want, but you're advised to avoid travel into areas that are Tier 3. So at the moment that's Liverpool, but there are some other areas I expect will be escalated over the next day or two. And to be sensible about your travel, you know, as I said, whenever you leave Birmingham, the rules that apply to you in Birmingham will apply anywhere else. So that gives you a sense of an overview of the thresholds at the moment. I'll just remind colleagues that have joined us to remember to mute yourself so we can avoid the background noise. And we will circulate that slide through to you as well, because I think it's a really useful summary. The final thing I'll say is I'll just put into the chat box some of the guidance on the national website around what you can and can't do at what we call the high level, because I think that's quite useful as well. If people ask you questions, what can I do? Please have a look at this, because it's a useful way of getting the message out, and we will get this graphic out to you. So I'll move on to answer some of the questions that are coming through in the chat. Centrala's point, absolutely. That's the reason we're advising people not to invite friends into their garden, because the reality is that you know, you're in the garden, it gets a bit cold, and you know, you want to be a good host, and you just say, let's just pop inside, it's all right, I'll just make you a cup of tea, and you hand over that mug of tea and you're handing COVID with it. And by bringing someone inside into your house, we know this virus spreads much more indoors. So you know, that's the temptation is just there. So I would say avoid it if you can. Go out and enjoy some of the wonderful green space we have across the city. So Dace asked about a limit for attendance of organised sport. Now I have to say that's not one I know the answer straight off the bat for. I think the attendance are included in the numbers and it's part of the risk assessment. So each sport, their governing bodies have got risk guidance. So for example, the Tai Chi Association has guidance that's different from the guidance for ice hockey. So if you are someone that's involved in organised sport, my first advice is always look to your national governing body and they're very good, actually. Most of them have produced guidance about this. I don't think there'd be a limit on the attendance, but it's part of the risk assessment, and the attendance have got to be spaced. However, there is a restriction on people not going to watch sport. So there is a restriction on not having spectators, and it's advised against in areas like ours that in tier 2, people are advised not to go and watch sport, whether that's amateur sport or organised sport at the moment. So Centrala asked about youth hostels and rooms with multiple beds. So like every other, like a hotel as well, they have to have a risk assessment in place to open safely. We're also working with where we've got hostels for the homeless in the city, for example. We work with them regularly as well. But the youth hostels and the kind of hostel hotels that have got multiple beds do have to have a risk assessment, and there is very specific guidance on the website for hotels about what they should be doing. And in general, I would say people should not be sharing rooms with people they don't live with. So that means if you've got a room with multiple beds, you can only put in that room someone who comes, people that share the same house who've come on holiday. Paula asked about testing and how accurate the testing is. Yeah, so what I would say, so Paula's asked about, she's got a member of staff who had classic symptoms, had close contact with a prior case, but tested, and the test was negative, and she's done a second test, but the result's not back yet. So what I would say is we do get false negatives, but they're not very common. And it depends a little bit on whether it's a postal kit, where it's a little bit more common that it's not picked up, versus a walk through a drive-through centre, particularly the drive-throughs where someone's doing it for you, have a slightly better pickup. But I would say if it looks like COVID and it behaves like COVID in terms of symptoms, even if the test is negative, I would still advise staying at home for the 10 days until the symptoms, certainly, and 10 days as a minimum. If the temperature continues, then you do have to isolate for longer until you're at least 48 hours without a temperature. Temperature is one of the strongest signs when our body's fighting an infection. So that's why we say to extend the isolation if you have got high temperature. There's a question from Jez come through about transmission rates in the workplace. It's interesting at the moment, what we're seeing, and this is true for schools and for universities as well, is we're not seeing any great evidence of transmission when people are doing their job, or when students or children are in the classroom. Where we see transmission is in break time. So whether that's in a workplace where people go and have lunch together, they go and have a cigarette break and they're huddling together, they're passing a lighter, for example, or it's kids playing in the playground or at the end of school at the school gate, that's where we see the transmission, not actually when they're in the class or actually doing their jobs. Now, there are some exceptions to that, particularly workplaces. We've seen in the wider region, places like abattoirs, factories where they're very noisy and people have been shouting at each other and they get close because they can't hear each other in the noise to be heard. But in general, we haven't in Birmingham had the big workplace outbreaks that other areas have had. What we've tended to see is it's either cigarette breaks, lunch breaks, or car sharing. That's the other thing that is a real risk at the moment. I really advise people, please don't share cars with people you don't live with if you can avoid it. If you are going to share a car with someone you don't live with, or you need to take a taxi, you should be wearing a face covering, the person driving should be wearing a face covering, and all the windows should be open, whatever the weather, because that really reduces your risk. Car sharing is something we've seen quite a lot associated with workplaces. So moving on to Chris Milton. Am I pleased with the way the figures are going in Brum? Are we better than worse? And do we need to see, what do we need to see to get restrictions lifted? And about a circuit breaker. So quite a lot in there, Chris. Am I pleased? Yes, I think I am, really. I think the city and citizens, you guys, are doing great. You know, I live in Birmingham too, so everything that happens to Birmingham happens to me. I live here. This is my life as well that gets restricted. And I have to say, you know, the last couple of weeks, really noticeable how much I live right in the city centre, how much people are wearing face coverings in the Bull Ring and out in the city centre, much more than they were a couple of weeks ago. You can really see more of the social distancing. Behaviour in the nighttime economy is much better as well. So all of that is good. When I look at the numbers, we are going much more slowly than other parts of the country. If you look at how Birmingham compares to other areas that have a similar level of deprivation, and actually I'll just show you this graph. I think I showed colleagues on one of the calls this earlier, but I think it's a really good demonstration, although it's a tiny weeny graph. So let me just blow this up a bit. Right, so this plot chart, and this was done by my counterpart in Samwell, shows local authorities by deprivation, so how, in effect, how poor we are compared to the overall case rate. And the lower the number on your x-axis on the bottom, the poorer your community. So you can see that Birmingham, which is in the red box, is towards the far left of your screen, because we are much more deprived than Solihull, which is the red writing towards the middle of your screen. But when you look at the actual case rates in Birmingham, we're tracking at this point, it was around 150, 160. Compare us to places that are just as deprived, like Nottingham, Manchester, Liverpool. They've got much higher case rates than we have. And the dotted line across the screen suggests where we would expect you to be if you followed the kind of average pattern of the relationship between deprivation and case rates. So what you can see is, in the general, the West Midlands is doing much better than you would expect, given our level of deprivation. And you know, that's a reflection of what everyone has been doing. So I do think we're doing a bit better than expected. I think in terms of you know, what we'll need to do to get the restrictions lifted, I think everyone's got to stick with it. The harder we stick with it, the flatter the curve is. But I think it's probably in reality going to be a situation where more and more of the country go into restriction. I've just seen on the news that London and Essex and York are moving into tier 2 with us. So more and more of the country will go into tier 2. And then we may see a full lockdown for a period. I mean, lockdown doesn't stop the virus. What it does is slow it down. So if we have a lockdown or a circuit breaker, what that's doing is basically trying to reduce the pressure on the NHS for a period. And when you relax it, the numbers go up again, as they have as we came out of the first lockdown. So we'll see. You know, at some point, Adrian's asked me about, will we go to tier 3? I think we will eventually. You know, I think sadly with COVID, the only way is up. The question is, you know, can we slow that? And we slow it by all the things we're doing about keeping that social distance, not inviting friends and family over. That's, you know, that's really important, because that is how we control this. You know, it's hard in a way, because we're giving people, you know, really simple advice. Wash your hands. Don't touch your face if you haven't washed your hands. Wear a face covering if you go into an enclosed space you don't live in, and keep that 2 meters distance from anyone you don't live with. Really simple things, you know, and the problem is people get bored, they want something new, and we've just got to keep on with that message. Rebecca asked about the guidelines for informal care. So there are exemptions to provide care and support for vulnerable adults and vulnerable children. And when I say this, what I mean, this is about going in. If you've got an elderly relative who isn't able to, for example, wash themselves, dress themselves, can't do their own shopping, then those are the kind of things that you can go in and help. But it doesn't mean you can pop round for a cup of tea. So it's really important when you are going in, you're going in to do the care, and you are leaving as quickly as possible. You're really conscious when you're there about what you touch, clean it down, wash your hands when you walk in, and really this is all about protecting the people you love and care for. And that's the bit you've got to keep at the heart of this, is we do these things because we don't want to give the people we love COVID. So that's why the advice is there. A couple of questions that have come through via Claire from Benita about support groups. Okay, yeah, so the questions around groups. If you, so basically, if you run a support group, you've got to have a risk assessment. You've got to, as part of that risk assessment, go through social distancing, keeping in mind how people come into the room, how they leave the room. Anything like toilets, for example, is really important. I think there was a specific question about a community lunch. I have to say I would avoid that at the moment, to be honest. I think that probably isn't safe. It'd be very hard to do that unless you can put each household on their own table, which means you've got to have quite a big venue. You couldn't do it because it's not about the table service is part of it, but it's actually how people are sitting, and you would need to see each household separately, which might kind of defeat the point of having that community lunch. There was a question about line dancing. I think there's actually some quite good national guidance for line dancing from the National Line Dancing Organisation. So do have a look up online. But you can do it if people are bubbled and they keep the 2 meters distance. I would view dancing, organised dancing, in that kind of class way, like physical activity. Tai Chi outside would be an organised physical activity class outside. So yep, that can go ahead. Breast cancer support meetings. So that needs to have the physical distancing and the risk assessment. And the same is true for the madrasa youth club as well. Sue asked about bubbles. If you're in a bubble, you're basically treated as a household. So if you're in a bubble where it's a one-person household bubbled with a second household of any size, they can behave as if they all live together, which means they can have a hug. So that's the bubble. Nargis asked about a question around schools to get children tested with a high temperature. So in order to, the reason you should get a test for COVID is any one of the 3 COVID symptoms. So if you've just got a temperature, get a test. If you've just got a new continuous cough, get a test. If you've just lost your sense of smell or taste, get a test. You don't have to have all 3. Now, we do know, of course, that a lot of people at the moment have got common cold going around. And I would say, COVID, it's very unusual to have a runny nose or that kind of sinusitis, headache and the pressure under the eyes. That's not really a COVID symptom. But often actually when you have that kind of common cold, you don't have the high temperature, you don't really get the cough without lots of streaming coming down your nose. And you don't usually get the loss of taste or smell. And it's quite distinct. If you do lose that test of taste and smell, try sucking on a lemon. You really will notice you can't taste it. So it is right to advise any parents or children, if you've got one of the symptoms, you should get a test done. Roz asked about cleaners. Yep, cleaners, there's an exemption for entering households if you are doing work. There's specific guidance for people working in other people's homes about what they should do in risk management. So yep, that's there as well. So question, which I think Mel's put in about pubs and restaurants are asking for proof of a household. How do you prove a support bubble? Well, I think realistically, all you can do is say you're a support bubble. Support bubbles are between a 1-person household and a multiple-person household. the reason we have support bubbles is to support people's mental health and well-being. And of course, there will be people that try and fudge the system, but they're only putting themselves at risk. You know, so I think most of our hospitality sector are being really pragmatic about this. So I'll try and pick up speed a bit because you're coming through thick and fast. So James asked about COVID secure. So let me just read this. Community hall for a permitted group activity. If someone from the orchestra developed COVID within a couple of days of attending rehearsal, what's the position of other members who attended the rehearsal? Would they be notified and do they need to isolate? And what happens if there's more than one outbreak? Because people need to understand. Yeah, no, really good point. So whoever's organising the amateur orchestra rehearsal, for example, should have a risk assessment. What happens if a case is identified? The CTAS system, the contact tracing service, will ask that person to fill in the online website. Where have they been in the 2 days before the day they developed symptoms or the day they tested positive? And if they said, well, I went and did orchestra rehearsal, then that will be escalated and they'll get a phone call and someone will kind of go, okay, tell us who organises it, how do we get hold of them? And they'd ring the organiser and they'd go through the risk assessment and work out, is there a risk to be considered? So how closely were people physically together? Was there mingling at the coffee bar? You know, was there a queue at the toilets? Those kind of things. And they make the risk assessment judgment based on the conversation of the organiser and feedback. Now, if that conversation says, well, actually, we've got all the risk assessment, but you know what, someone bought a cake and everyone crowded round and they didn't keep the 2 meters distance, then the advice would be, okay, we need to contact everyone and they will need to isolate for 14 days. So we work with the organisers to get the message out and get the information out. The other thing, of course, is if people have downloaded the NHS app, then also when someone tests positive, they let the app know, and the app would know if you've been within that 2 meter distance. So it would also alert you as well. If there was an outbreak, and in terms of, so the other thing it says, if there was an outbreak among members of the orchestra, assuming everything being adhered to and no negligence, could anyone be held responsible? So in general, we're not seeing any litigation about spread of COVID in workplaces, but there are processes in place if that was needed under the Health and Safety Executive. You know, and what we see in general is if all the risk assessment have been followed to the letter and actually everyone's been really good, when you get multiple cases, you have conversations with people and you realize that actually 3 people shared a car to come to the concert. And actually that's how they infected each other, or they went for you know, popped home for a coffee in someone's house at the way home. So we do quite a lot to really unpack, is this a failure of risk management, which is relatively unusual in places that have got good risk assessments, or is it actually there's something else going on? And you know, as I said, at the moment this is not a litigious part of the world, but that could change. Adrian asked about the suspension of drop and collect. So we have paused drop and collect. There was a mistake made, quite a serious mistake made on Monday. We're investigating that. We're working with the individuals involved to make sure they're safe and supported. And we're reviewing the service. So, you know, I'm not going to comment any further on that because that's part of an investigation. But Public Health England are supporting us with that. You know, and it is an isolated incident from everything that I've seen so far on that. So Nargis said emails are helpful. Can we be sent a list of places, numbers where people get tested? So the answer is it's really simple. It's online. So if people want to get a test, ring 119 or go on the NHS website and I'll work with Mel. We'll get something out to you tomorrow. We'll also send something through the text messages as well on here's how to get a test. Once we have the WhatsApp groups up and running, we'll also start to do audio clips for you because we know that there are lots of people that don't read particularly well. So actually having a verbal clip is quite helpful. And there is a plan to do that as well. And Tay asked about accurate and reliable are the daily numbers, and how good is it? Yeah, good question. If you're a really close follower of the numbers, you will see they go up and down a fair bit, even for the same day. And that's because different laboratories take different lengths of time to return lab results. The majority of lab results are now done within a maximum of 4 days. But actually most are done within 24 to 48 hours of someone getting the test. But it does mean that we wait, although I can look at the numbers daily, when you see the national announcements, they're doing them weekly, and that's because of this delay in the labs processing what's going on at the moment. The test and trace system is challenging, to be honest, folks. There are lots of people that don't answer their phone, that don't want to talk to the test and trace system. We're doing some of this locally now, so some of my team are doing those calls themselves, and I'm getting really good feedback on what it is people say. And I'm sad to say some people aren't great, but I'm hoping that more people understand why this is important, because actually test and trace is about trying to identify who's been put at risk and helping give them the right information to protect themselves and their families. So it is something we will be asking you guys to help us with, is help people understand that. So Catherine, so with university students who are away doing lessons online, if they want to come home and are COVID-free, can they come home to continue their education until the end of term or the end of the year? So there is an exemption for moving house. So if students are going to go home because their courses now are online, then they're moving house, they're moving for good. What they can't do is go home for the weekend and go, actually, I want to go back and see my mates and come back again. So it is a very definitive decision. You either go or you don't. In general, I think most of the universities in Birmingham are doing hybrid teaching. This is because face-to-face teaching is definitely better than everything online. It's also good for students' health and well-being, but they're only bringing in students in small numbers where it can be carefully managed to support them, and where they need to. So for example, in laboratories, really hard to learn how to do a chemical experiment watching someone else to do it on the computer, because some of what you've actually got to learn is how you measure out the chemicals, mix them in the test tube, all of that. And I saw one of the universities shared with me what they're doing, that each lab has its own little Perspex cubicle, and they've got one student in at a time and 3 computer screens. So the 3 computer students who are joining virtually are doing the analysis of the data that's coming through from the experiment that the student in the lab is doing. And that way they can keep socially distanced, small number of students in a big lab, but actually all of the students get that participatory experience of taking part in the experiment, which I thought was a great idea. We are seeing no evidence of transmission yet within the classroom. Where we're seeing evidence of transmission in students is in shared accommodation and where they've all got together and gathered outside of class. Question from Melissa about, if you have flu symptoms but not typical COVID, do you need to get a test? So I would say only get a test if you've got one of the 3 key symptoms. So high temperature, continuous new cough, or loss of sense of smell or taste. If you haven't got those and you've got body aches, runny nose, but you're not running a temperature, then don't get a test. You've probably got a common cold that's going around at the moment. A question from Catherine about the bubble. Can a single adult who lives in a shared household with other single adults form a support bubble with another household? Really great question, that one, Catherine. The answer is, I'm afraid, no. If the single adults live in a household with a shared kitchen or shared bathroom or both, they're treated as a single household. So it doesn't matter, they've got their own bedroom and they may have their own bathroom, but if they share a kitchen, for example, or there's a common TV room, then they're considered, the whole building is a household and they're not able to bubble. I'm afraid we did have this conversation with a couple of our supported houses a couple of months ago, actually, when the bubbles first formed. And I know it's really, really difficult because there are people, for example, in treatment for recovery from addictions who desperately want to be able to see family or relatives, and they can't because they're in a rehabilitation unit with shared kitchens. Catherine asked about transmission on train. We're not seeing evidence of this at the moment, although it is an area there's a lot of research going on nationally. There certainly was concern in London that transmission on the tube, which is obviously a lot more compact, if you've ever done London Tube in rush hour, you know quite how intimate you get with other people. There's no way you can space 2 meters distance of being a risk. You know, I think generally, I've been on the train once in the last month. Everyone was wearing face coverings. There was good social distancing, and the train staff, it was an Aviva train, were very good at saying to people, actually, I need you to move because you're sitting too close to each other, and if you don't live together, we need you more further apart. So it's getting there. Julie asked about mask compliance. Is it good enough? Well, we can always use more. We're doing a lot of publicity. That's where you've seen the No Bull campaign. You know, but that's part of the thing of having the COVID champions, about you helping us get that message to people and go, look, you know, this is not a drill. People are going into hospital. People are dying again. And wearing a mask is really important. But keep in mind, the mask is the kind of icing on the cake. The most important steps are hand washing and avoid touching your face, because that's how the germ gets into your body. You touch something that's got germ on it, you touch your face, and the virus can't break through your skin, but what it can do is crawl across your face into your mouth, up your nose, or into your eyes, and that's how it enters the body. So really important to wash your hands before you touch your face. Keep the social distance, keep that 2 meters much as you can when you're out and about, and then the face coverings is that third tier. But the most important thing, hand washing, don't touch your face, and keep the 2 meters distance, and then the face covering. Debbie said about son was tested because he had a continuous cough, and she got him tested, and although she thought it was probably something else, she kept him home. And I think that's absolutely right. You're completely right, Debbie, in what you're doing there. We've all got to be responsible. Andrea asked about what are pubs and restaurants doing to make sure, and are they checking? So I haven't been out, I have to say, since the new guidelines came in. But I know before they came in, actually, I booked a table at Craft, which is a great restaurant, really recommend, in the town centre by the ICC. And actually, they rang me back after the booking and said, can I just check how many households is this booking for? These are our COVID safe procedures. So that was a great example of a venue doing the right thing. So what I would say also, though, is there is a small exemption for outdoor. So if you're going to an outdoor street cafe, you're sitting on a table outside in a pub, that's where you can actually sit with someone that you don't live with. Now we are working to get some clarity on that guidelines, because I'm not great fan of that one, but currently that is an exemption, but it is on the venue to do that checking. What we as a council do are following up when we're told that venues aren't doing what they should be doing through the whistleblowing helpline. That's one of the things that it's reasonable to ask. And if a venue can't show us how they're making sure that households aren't sitting together, then we will take action. And you will have seen, I think earlier this week, we took quite forceful action over a venue that wasn't doing what it should have done. Yeah, so Debbie asked about why aren't we as strong as Spain? Yeah, I mean, I think it's just different cultures, Debbie, about how fining and how enforcing you are. And I'm sorry to hear you got fined for not wearing a mask when you're in Spain, but you know, I think we will see more here. You know, that's a national decision, I'm afraid, not a local one. Ian asked about should we have restrictions that only apply to parts of the city? I mean, the reality is, if you look at the pattern across the city, all of the city is heading upwards to differing rates and differing degrees, but certainly over the last month we've seen that increase in cases, whether you're in Sutton Coldfield, Northfield, Hall Green, over in Oscott. Pretty much everywhere has been either going up, coming down, going up again, but the general direction of travel over the last month is the whole city's going up. And the practicalities, we've already had challenge about, well, do people know if they live in Birmingham or Solihull or Warwickshire? If you tried to kind of draw a line and go, do you know that you live in Ladywood rather than Nechells? I'm not sure many people would be able to go, yes, I'm definitely one or the other. So, the national view is you go in as a whole local authority area, or you don't. But they're not now at this stage in the outbreak. There is no ability and no sense of doing it at any smaller geography level. It is the whole, all of us together as Birmingham together, or not. Tanya asked about people in communal settings. Are they allowed to meet in a communal garden? Yes, because you're allowed to meet people outdoors. And I would view in that kind of big venue where there's a big outdoor garden, and of course, they are close to their own flats, so they can pop back to the loo in their own flats. They don't need to go into anyone else's. That probably is okay. It's slightly different from most of us where it's our own garden, or in my case, relatively small balcony. So Dace asked about, we're into the last 10 minutes now, so I'll try and speed up. Music bands give a concert if public sit at tables in bubbles. So there is guidance online on the government website for what musicians can and can't do. So I'd say have a look at that. From the point of view of the venue, whoever's hosting it, yes, people could sit at tables in their bubbles. That would be fine. But there have been some updates to what you can and can't do in terms of live music. So I would say have a look at that. Terms of basic risk assessment, Lynn, you asked about used to personalise in your own circumstances. Not sure there is really in that sense, but what I would say is there is a great website called germdefense.org, which I'll put in the chat. Germ Defense is a website. It's available in about 60 or so different languages, and it's about doing risk assessment for your own home about how you stop spreading viruses. So do share that around. It's a great resource. It's endorsed by Public Health England. Joy highlighted National Youth Agency's got a traffic light risk assessment system for youth clubs. Also, I would say borrow with pride from other people. Many of the face settings have got some really good tools for risk assessments. Sue Gorn asked about limit of 15 people at support groups. And I'm just seeing, do you know, Mel, if you're online, if you can just have a look on the guidance and see whether we can highlight. Otherwise, we'll get back to you on that one to see clarification. It's fair to say this week, because the guidelines changed, not all of the national websites quite caught up yet. So when we find things where two bits of guidance don't match, we highlight that nationally. So if you do find conflicting advice, pop an email through to the team and we'll get it escalated and help clarify for them. Great, Debbie, to feedback that the drive-through site at the airport, which is the regional drive-through site, was really good. I have to say I've had really good feedback on the drive-through and the walk-through sites recently. The Polish expat says something about the ghost alert. I do understand that. I've had one also where it's told me you might be at risk, and then about 10 seconds later, actually you're not at risk. Come through. We're all getting used to it, yeah, and the ghost alert bit of it tells you there's an icon there. Is annoying. It is getting better. So Debbie said Solihull College are moving classes online next week. Yeah, I think some of the schools are. I have to say, because they've got a lot of cases in teachers, or a lot of teachers isolating at the moment. And the thing that seems to be most likely to lead schools to close or go completely online is that teachers being off more than anything else. So Alison said about Woodgate Valley not being particularly well used. Yeah, it varies at the moment. We're seeing across, and we get data through on the sites, and we are continuing to look at the sites about should we move them if they're not being used very much? What does it tell us? The problem is actually the sites have got a very specific space we need. So we have to have about a 30-car car park. It has to be tarmacked. It's got to have an entry and an exit. It's not that easy to find them. And also there's no money to pay for rent for them from the government. So we've had to use venues that we either own or like the sites at the university where the university have given them to us for free, which is one of the challenges, why we haven't got them everywhere. Jez says, what are the actions to take if you feel you're in an environment which isn't safe? And the answer is, if you're in a workspace that you feel isn't doing what it should, then that's why we set up the whistleblowing website. Actually, it's the very reason we set up the whistleblowing website was because in one of our neighbouring authorities, there was an outbreak in a workplace, and the only reason they found out about it was because someone whistleblowed, and a lot of the staff said we knew it wasn't right, but we didn't know what to do. So I put that link in the chat. Guidance for moving house, that's on the national government website about what you can and can't do. So do follow the link and have a look up there. Tier 3, I would say we're, I don't know, I think we're probably weeks. We're certainly not days away from tier 3. And it depends a bit on how hard we all work at the moment in terms of whether we can get the rate down or we can slow that rate of increase. And the better we can do that, the longer we'll stay in tier 2. And we might get down to tier 1. But if we all give up, then we'll very quickly be in tier 3. Andrew asked about if an individual had surgery booked tomorrow and tested positive for COVID today, will the surgery be cancelled? Yes, I think it would, unless it was urgent surgery. And the NHS would have a conversation with the patient, work out what was in the best interest of them clinically. In general, it's not a good idea to do surgery on someone that's got another infection going on at the same time. We try to avoid it if we can, because it's, you know, it's just not great for healing and recovery. And particularly in something like COVID, which is a respiratory virus, it can complicate the anaesthetic. Darius asked about, is it okay to meet in communal gardens? Yes, at the moment it is. Rule of 6 applies. So you can meet 5 other people outside, but no more than 5. David asked about other symptoms. Yeah, there's a huge amount of work going on, particularly about children, and do children have different symptoms? And currently the national view is that children don't have other symptoms without one of the 3. So what you do see is children have a high temperature and they may get abdominal pain, but they don't just have abdominal pain and no temperature, no cough, no loss of sense of smell or taste, and turn out to have COVID. So we do find that children tend to have more symptoms, but they usually have at least one of the 3. And the most common one is the high temperature. Sore throat is not very common in COVID. And as I said, nor is a snotty nose. Darius asked about, communal garden, maximum you can meet is 5 other people. So it's the rule of 6. Adrian, I'm really sorry, I'm a bit depressing. You know, I mean, the reality is I try to be honest with you guys about the current situation. I do think if everyone takes heed, does what they're asked to do, we can slow the speed of this. And Birmingham is being looked at by quite a lot of national government at the moment, because Birmingham and the West Midlands is behaving much better than you would expect it to. So that graph I showed about, if you look at everything that's going on in Birmingham, you know, how deprived we are, how many people live in houses that are overcrowded, how many people that work in the hospitality sector and in industry, we've got all the things that would suggest that COVID here would go like wildfire. And it just hasn't happened. What we've done is we've done this stepwise approach, and each time we brought in restrictions, we've managed to slow things down. And nowhere else has really managed to achieve that in this way. So I think we can bring it under control. I hope we can reverse it. But the other thing to keep in mind is that the more we keep this under control, we are really saving lives. The last wave, the first wave of COVID, we lost about 1,400 people to COVID. And those are the people that actually died of COVID. They had COVID within 28 days of dying. It was on their death certificate. And we're pretty confident that's what caused their death. So that's after all the cleaning of the data had been done. And that's a really important point to highlight. It's not just about bringing cases down and getting the restrictions relaxed. It's actually also about stopping people dying, because when we came into this, all of the modelling suggests that Birmingham would lose between 5,000 and 9,000 people to COVID. So I'm really hoping that we can all work together to bring that down. And I think it will take a while for that to happen. So the final question I'm going to cover, because we're at time and I don't want to eat up any more of your evening, is the question about asymptomatic people. And Nargis said it, children silent carriers. No, we're not seeing that. What we are seeing is that there are people who test positive who don't have symptoms. We think that in general, people who don't have symptoms are probably less infectious. They can still be infectious, but they're less infectious. And the theory behind that is the more virus you have in your body, the more likely you are to have a really kind of strong reaction to it. That's what the temperature, that's what the loss of sense of smell is. Your body is fighting this virus, and that's why you feel rotten with it. So we don't think people who are asymptomatic are super spreaders. It's much more likely people who have symptoms are, but there is a risk, and that's why people who are asymptomatic who test positive have to stay at home. And as we look forward, and we're going to be doing these every week. Or you'll be different people each week, because you'll understand I need a bit of a break and a bit of downtime as well. And what we're also going to try and do is say to you, actually, the person coming is the particular lead on this. So it'll be people from my team. We want to do a session particularly around care homes and older adults. We might do a session particularly around schools and education as well. We can do one particularly around the testing system. So we're just building that forward plan with Mel and Ricky and the team for you to help you answer questions. And in the meantime, drop any questions that come through to the team, and we'll do what we can to help. We'll come back to you perhaps and do a session about what's going to happen with flu and where we're heading on that as well, because I don't want to keep us on tonight. But I just pick up that comment from Shabina, which is a great one about, it can be really bleak. You can look at this in really difficult ways and glass half empty, or you can say, actually, we're in this together. There's so much community spirit. There's so much to play for. There's so much that we can do to save lives and to make it through the next wave as safely as possible, and to protect as many people we can. And you're absolutely fundamental to doing this. So thank you for all your time tonight. We've got the recording that will be shared out with the champions as well. And I no doubt we'll get to talk to you all soon. So hang in there, everyone, and thank you again for your help.
Thank you, Justin. So just very briefly, everybody, I know we're over time. I'm just going to run through the last few things. Okay, so we mentioned last time that we've got a dashboard that's going out weekly. We originally said this was going to be on a Friday, but this is actually going to go out on a Tuesday now. So there will be a dashboard that gives you a bit of an idea of where we are in numbers with the city. We've been getting emails in about different questions from champions, which has been great. So it's great that we're getting that two-way communication. So do continue sending your emails in to us if you have got questions. We've got all of our social media channels. We are on YouTube, Facebook, Twitter, Instagram. So Claire's just put in the chat all the different links for our social pages. So please do follow those, and that's a great way of resharing on your social media platform. But also you can utilize some of those graphics on WhatsApp and what have you. We've got some links to resources on our champions pages, and I think the link's in the chat again for that, and also our Birmingham City Council COVID pages. And the last thing that I'm going to rush through is that if you know anybody in the city who has a business, owns their own business or works at a business, Justin is hosting a business COVID question and answer session on Tuesday evening at 5 o'clock till 6 o'clock. So we'll circulate those details as well. So if you know anybody that might be interested in listening to Justin talk from a business point of view about COVID, then please do share that information over. Thank you very much for joining us. I'm going to leave it there, and we'll speak to you all soon. Good night. Stay safe.
Good night, everyone.